And we're back. All right. So what I want to do now is I just want to run down some terminology because there's a lot of confusing terminology here, and we'll try to make sense of it because a lot of it's used interchangeably. First of all, what is the difference between an agonist and an antagonist? What does an antagonist do? It's against. It antagonizes something at a receptor site. And an agonist does what? It stimulates or enhances a certain action at a receptor site. So, let's say that I were to give a medication, albuterol. Albuterol. It is known as a beta-2 agonist. So, what receptor site does it act upon? Okay, it acts upon a sympathetic. Which sympathetic? There are different types, though. A sympathetic beta-2 site. And it's an agonist, right? So what would we expect the effect to be? Bronchodilation. Right. Bronchodilation. All right, good. Let's say that I were to give a medication called Brevibloc. Don't worry, we haven't covered it yet. It's called Brevibloc, and it is known as a beta-1 antagonist. So where does it work? Sympathetic or parasympathetic? Sympathetic.
Beta-1.
Beta-1, and what would we expect to see?
Increased heart rate.
Increased heart rate?
Decreased.
It's an antagonist. Don't let the terminology trip you up. So it is a beta-1 antagonist. It prevents action at the beta-1 receptor sites. So we would expect a decrease in the heart rate, a decrease in contractility, a decrease in conduction, and so on and so forth. All right? Let's say that I were to give somebody atropine. Okay, atropine. And I'm going to throw a new word in. It is a parasympatholytic. Whoa, that's a big old word there. A parasympatholytic. So parasympatho involves the parasympathetic nervous system. Lytic, what does that mean there?
Well, it's going to be antagonist.
Antagonist, exactly. It is a parasympathetic antagonist. Anytime you say lytic, that means antagonist. So if I give atropine and it is a parasympatholytic, what does it antagonize? The sympathetic or parasympathetic? Parasympathetic. What kinds of effects would we want to see? Or would we expect to see? Increased heart rate. How about secretions? Decreased secretions. What about our bronchial smooth muscle? What's going to happen to the bronchial smooth muscle? Dilate. Ah, good. Dilate. Okay, good. All right. So antagonist versus agonist. All right. So to finish things up here, before we go into a little review, I want to go ahead and discuss sympathetic versus parasympathetic one more time. Okay? So, sympathetic. Parasympathetic. Okay. So let's go ahead and try to make some sense of this stuff. Different words that mean sympathetic. There are different words that all mean sympathetic. The first one is adrenergic. Okay, so if I'm talking about something that's adrenergic, it involves which branch? The sympathetic. And think, adrenergic is adrenaline, right? And adrenaline comes from the adrenal gland. And where is the adrenal gland? What does ad mean? You add, so you're on top of the kidney. Yeah, that's why we call it the adrenal gland. It's adrenal, or on top of the kidney. Okay. Adrenergic means sympathetic. Sympathomimetic is another term you'll see used. S-Y-M-P-A-T-H-O, sympathomimetic. And the way that I look at this is mimic, right? This means to mimic or copy the what? Sympathetic. So adrenergic, sympathomimetic, sympathetic, all the same meaning fundamentally. And then there's one more word that you'll run into, and that is, starts with a C. Can you guys think of it? Catecholamine. Catecholamine, right? And what is a catecholamine? It's a neurotransmitter for the sympathetic. What are the three defining characteristics of a catecholamine? Benzene ring, 2 hydroxyl groups, and an amine side chain. Right. So a catecholamine is an adrenergic, is a sympathetic, is a sympathomimetic, all pretty much the same. The actions are going to be the same. Would you guys agree? Okay. All right. So, what is an anti-sympathetic medication called, though? So anti-sympathetic. Sympatholytic. Absolutely correct. Sympatholytic. Okay. That is against or anti-sympathetic. That is an agent that works against sympathetic nervous system. Okay. We also call those alpha, beta 1, or beta 2 antagonists. Antagonists. All right, antagonists. Anti-sympathetic, sympatholytic versus a sympathomimetic, which is a sympathetic. Everybody's okay there? You guys all right? All right, good deal, good deal. And we covered the 3 defining characteristics. What, and I haven't covered this yet, but what enzymes are involved in breaking down adrenergics, sympathomimetics, catecholamines, sympathetic neurotransmitters? So what is the enzyme that breaks acetylcholine down? Acetylcholinesterase, ACHE. There are 2 enzymes that we worry about, and they are COMT. I'm not actually going to say the entire name. If you got this, COMT, and MAO, or monoamine oxidase, you're good to go. Okay, trick question now. Trick question. When you guys are doing your drug cards and you ran across albuterol, was there a contraindication for albuterol? Those of you that done your drug cards, was there a type of medication that we really don't want to give with albuterol, which is a sympathomimetic agent? I'll give you a hint, it's a kind of antidepressant. There you go. MAOIs, monoamine oxidase inhibitors. So think about this. If I give even if we've never covered them, let's just think about what we know of the nervous system. A monoamine oxidase inhibitor inhibits what? Monoamine oxidase, MAO, right? MAO is an enzyme that helps break norepinephrine down, right? What happens if I inhibit that enzyme? Can I efficiently break norepinephrine down? What do you guys think? No. So is norepinephrine going to stay attached to an adrenergic receptor for longer? Yes. So what happens if somebody's taking an MAOI, a monoamine oxidase inhibitor for their depression, and their levels of MAO, or their MAO is inhibited, it cannot break sympathomimetics down, and I give somebody a sympathomimetic, do you think the action of that sympathomimetic is going to be prolonged much longer? What do you think? I can't break it down, right? Because this is what I use to break it down here. So if I give somebody, say albuterol, can they have sustained tachycardia, really high heart rates that are hard to control? Yes. Can they have a sympathetic crisis, depending on the sympathomimetic agent I give them? What do you guys think? Absolutely. And that is why we do not generally want to give sympathomimetic agents to people that take monoamine oxidase inhibitors. We want them off that monoamine oxidase inhibitor for at least 2 weeks. Now, here's another question. Let's say I have somebody that is on a monoamine oxidase inhibitor, and they just had an anaphylactic reaction to a medication. You guys know what anaphylaxis is, right? It was actually Blue Light Special from the first lecture. What medication do we give to treat anaphylaxis? Epinephrine, a sympathomimetic and adrenergic. What do you think? Better not give that epinephrine, right? What do you guys think? Is it contraindicated? Yes or no? Is it contraindicated per what you've read and what you know? Yes. What's going to happen to the patient if they don't get it? And they are in a severe anaphylactic reaction. What's going to happen? Yeah, they're going to die. They're going to die. So sometimes we get into a situation where we're not going to win, and we have to make the best decision at that time. And in this case, we may have to give that patient epinephrine, knowing full well that they're on a monoamine oxidase inhibitor, and we may have some problems. But what are the alternatives? Well, there really aren't. So you're going to run into those real sticky, ambiguous situations. However, on tests and things like that, they're not going to make it that ambiguous, so you don't have to worry about that. But in clinicals, you're going to run into situations where you're not necessarily going to feel as comfortable giving a medication, and that's where you really need to think about, okay, what are the risks? What are the benefits? Why am I giving this? And do I need to give this? If I need to give this, we give it, and we just monitor them very closely. Would you guys agree? Okay, good. Okay, let's go ahead and wrap the parasympathetic up here. So, parasympathetic. Another word that means parasympathetic is cholinergic. And that is what? Cholinergic means what? Acetylcholine, yeah. Cholinergic is an acetylcholine response. Are you guys good with what a cholinergic response is? What happens to the heart rate? Decreases. What happens to secretions? Increase. What happens to smooth muscle in the bronchioles? They constrict. Those are the biggies we got to worry about. Cholinergic response. Are there cholinergic drugs that we can give? Can you think of any reason why I'd ever want to give anybody a cholinergic drug? Nothing but badness comes from them. Why would we give them? And it's something you're going to run into in a few semesters when you do pulmonary function testing. Sometimes people that have asthma, we will give them a cholinergic medication to cause bronchoconstriction. And we want to see how sensitive their airways are. We call that bronchial provocation. It's nothing that I'm going to test you on in this class, but you will run into this in a few semesters. And it's called methacholine. And it mimics acetylcholine. And we give it to basically induce bronchospasm, and we see how much of that medicine it takes to cause a response or reaction. And you guys will get into the provocative response 20% and all that later on. You're not going to have it here in this class, but I just want you to throw that in the back of your mind, so when you run into that in a few semesters, you'll be like, oh, methacholine, that's a cholinergic, and it's causing a cholinergic response, which will cause bronchoconstriction, increased secretions. This is basically mimicking an asthma attack is what you're doing with a drug. That's one of the few times we'd actually look at giving that. Okay. Parasympathomimetic, all right? Parasympathomimetic also means cholinergic or parasympathetic. So if I were to ask you, what's the difference between a cholinergic and a parasympathomimetic response, how would you reply? They're the same. Yeah, it's going to be about the same response. Okay. Now, anti-parasympathetic is not going to be parasympathomimetic. It's going to be lytic. Parasympatholytic. Or anti-cholinergic. Okay, so if I were to say I'm going to give ipratropium, and you guys have started your drug cards, have you come across ipratropium or Atrovent? The Combivent, or the Duonebs that have the mix? What is ipratropium or Atrovent? It's a derivative of atropine, and atropine is what? Is it this one or this one? Trick question. Is atropine a parasympatholytic or an anticholinergic? How many of you guys think it's this one? Raise your hand if you think it's this one. Raise your hand if you think it's this one. Okay. Raise your hand if it doesn't matter, it's both. It doesn't matter, right? We're talking synonyms here. They mean the same thing. A parasympatholytic medication is an anticholinergic medication. Is everybody okay there? These are synonyms, just like these are synonyms. Sympatholytic, or an alpha, beta 1, beta 2 antagonist, they are the same thing. They antagonize the sympathetic nervous system, just like a parasympatholytic or an anticholinergic antagonizes the parasympathetic nervous system. These are synonyms, just like these are synonyms. Is everybody okay there? These mean the same thing, these mean the same thing. It's just different words. And that's what I want you guys to realize. Okay, what is the primary enzyme that breaks acetylcholine down? ACHE or acetylcholinesterase. All right. Are there substances that can inhibit acetylcholinesterase? What do you guys think? We know that there are substances that inhibit MAO, right? Enzymes that break down sympathetic neurotransmitters. What do you think here? What did we just mourn over this weekend? 9/11, right? And I think most of you are old enough to really remember that. Yeah, I was in my 20s when I remember it quite vivid. I was in my 20s in the military, so I remember it very vividly, exactly where I was, what I was doing. That was kind of the end of innocence for the United States. I think most of us would agree that whatever innocence we had as a country ended, and we kind of went into a new age of terrorism, right? And are there lots of things that we need to worry about with terrorism? Yes. And something called chemical warfare is a major concern. And have you guys heard of something called a nerve agent? Everyone's seen The Rock, right? Was that the movie The Rock with Nicolas Cage? And the nerve agent missiles, and the nerve agent gets released and the face melts off and all that. That's not what happens. Nerve agents work by blocking this enzyme here. So this allows acetylcholine to do what? To pile up. And it creates a massive parasympathetic response. So if you were to see somebody that was exposed to a nerve agent, nerve gas, what do you suppose they'd look like? They'd had a massive parasympathetic response because acetylcholinesterase is inhibited. What would their heart rate look like? Low heart rate. Low blood pressure. They have secretions? Lots of secretions. Would they have bronchospasm, wheezing? Absolutely. Absolutely. They'd have all that stuff. And that's something that we worry about. Also, do we run into that here in New Mexico quite a bit in the hospital? Nerve agent poisoning. Does anyone, I know there's at least one firefighter. Where do nerve agents come from? Where are they derived from? Sort of. It's something that we use all the time here in New Mexico and in Mexico. Are insects a problem? Do they eat insecticides? Nerve agents are derived from what are known as organophosphate insecticides. That's how insecticides kill insects. By inhibiting acetylcholine in those insects, they have a massive parasympathetic response and die. That's how all that the diazinon and all that stuff that you spray out in your lawn to keep the spiders and stuff away. That's how it works. By inhibiting acetylcholinesterase. But anyway, that's something that you guys will run into in a few semesters when you have to do presentations on biological hazards. Somebody's going to have to do a presentation on nerve agents. So that'll help you out there in a few semesters. Okay, guys, so sympathetic, parasympathetic, are you guys reasonably comfortable? You feel a little better? I know reading the book might have been a little confusing. Okay.